Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I'll discuss Parkinson's disease. Parkinson's disease is considered a neurodegenerative disease because it involves the degeneration and death of neurons. It is most frequently seen in adults over the age of 50. The most recognizable symptoms of Parkinson's initially are movement-related and generally involve a tremor that is worse when a person is at rest, bradykinesia, which is slowness of movement, rigidity, and postural impairment. Parkinson's patients also often experience non-motor symptoms like cognitive impairment or psychiatric symptoms. The causes of Parkinson's are not fully understood, but a combination of genetic and environmental factors is likely involved. Parkinson's patients have low levels of the neurotransmitter dopamine in the basal ganglia, a group of structures involved with movement, among other functions. These low dopamine levels in the basal ganglia are caused by the death of dopamine neurons in a region of the basal ganglia called the substantia nigra. The substantia nigra has high numbers of dopamine neurons, but by the end stages of Parkinson's, patients have often lost more than half of the dopamine neurons in this region. The most common treatment for Parkinson's involves an attempt to restore depleted dopamine levels in the basal ganglia. Because dopamine does not cross the blood-brain barrier, dopamine cannot simply be administered to a patient. Instead, however, patients can be given a precursor to dopamine called L-DOPA. L-DOPA can cross the blood-brain barrier and is used by the brain to synthesize more dopamine. This can lead to improvement in the motor symptoms of Parkinson's, but L-DOPA does not halt the neurodegeneration that occurs in Parkinson's disease. And long-term use of L-DOPA can cause a number of side effects, including movement-related problems. So it's not a cure for the disease, and other treatments are still being explored.
Parkinson's disease, or PD, is a neurodegenerative disorder in which dopamine-producing neurons of a brain structure called the substantia nigra are damaged and die over time, leading to a number of motor problems and mental disabilities. The substantia nigra is part of the basal ganglia, whose major function is to inhibit unwanted motor activities. When a person intends to make a movement, this inhibition is removed by the action of dopamine. As dopaminergic neurons are progressively lost in PD patients, low levels of dopamine make it harder to initiate voluntary movements. The events leading to neuronal cell death are poorly understood, but the presence of so-called Lewy bodies in the neurons before they die may offer a clue and is currently the subject of intensive research. Symptoms develop slowly over time. Most prominent are motor problems, which include hand tremors, slow movements, limb rigidity, and problems with gait and balance. These motor symptoms are collectively known as Parkinsonism. However, Parkinsonism may also be caused by a variety of other factors, which must be excluded before a person can be diagnosed with PD. Other motor-related problems may include slurred speech and reduced facial expressions. In later stages, non-motor symptoms such as mood and behavioral changes, cognitive impairment, and sleep disturbances may be observed. The cause of Parkinson's remains largely unknown, but is likely to involve both genetic and environmental factors. There is no cure for PD, but current treatments are effective in managing motor symptoms. First-line treatment involves medications which aim to increase dopamine levels in the brain. Major classes of medication include levodopa, a precursor of dopamine. Levodopa can cross the blood-brain barrier and is converted into dopamine inside the brain. Levodopa is the most effective of all medications, but because it also produces dopamine elsewhere in the body, its side effects may become serious in the long term. For this reason, levodopa is always administered together with some other drugs that inhibit its action outside the brain. Dopamine agonists, substances that bind to dopamine receptors and mimic the action of dopamine. Another class of drugs includes inhibitors of enzymes that break down dopamine. For people who do not respond to medications, surgery may be recommended. The most commonly performed procedure, Deep brain stimulation involves the implantation of a device called a neurostimulator, which sends electrical impulses to specific parts of the brain. By doing so, the device controls brain activities to relieve symptoms.